Thank you. It's a pleasure for me to present this poster on behalf of this working group. You may have heard the quote, "No research discovery, no matter how amazing, will save a patient's life unless it first traverses a learning environment." We must assist current health professionals in recognizing the increasing body of knowledge around sex and gender differences, and even more so, passing knowledge into medical education. This is attributed to Dr. Marjorie Jenkins, and for many of us working in the curricular space, this has become the banner behind which we are marching. The work to develop the 4 core tenets that I am presenting today in this poster arose from the challenge that the incorporation of sex and gender content into the health professions curriculum is met with barriers. These barriers have been presented and discussed at various sex and gender health education summits, and one significant barrier is the structure and language of curriculum itself, especially across multiple health professions curricula. Each profession has their own accreditation standards and competencies. Moreover, each employs different organizational frameworks and terminologies to categorize and label these competencies. After the first Sex and Gender Health Education Summit of Medical Professionals in 2015, the educational focus was expanded to an interprofessional one, and in so doing, the challenges of these disparate languages became apparent. In developing programming for the 2018 summit, where participants would learn with, about, and from a diverse group of professions, the range of ways in which sex and gender content was defined and included, or not, in professional competencies was compared. If the desire is to prospectively design and ultimately assess curricular content focusing on sex and gender, and to do so in a way that allows multiple professions to work together in mutual understanding, a common set of core concepts would be needed. The outcome of the 2018 summit yielded the effort to draft this core set of educational concepts, and this was very much inspired by the work modeled by IPEC, the Interprofessional Education Collaborative, in developing the core standards for interprofessional education. Our first draft was initially comprised of 10 abilities, 6 of which were knowledge-focused and 4 of which were skills. The draft was presented at Single Profession Forums in 2019 and then brought to the 2020 Sex and Gender Health Education Summit. Here, they were presented, followed by a workshop of facilitated interprofessional groups where these were reviewed and revised. Ultimately, the output of these groups was compiled to yield the final 4 core tenets, which was presented at the close of the summit. From there, an interprofessional writing team further refined and developed these into the final form published in the Journal of Women's Health this year. The 4 tenets cover the following areas. Number 1 involves knowledge of sex and gender health. All health professionals should be able to understand and be able to describe terminology, definitions, concepts, and sex and gender differences in anatomy, physiology, and pathophysiology, as well as psychosocial cultural factors, behaviors, health systems, and social determinants of health. Number 2 involves sex and gender data in the literature. Whether evaluating published literature or contributing to it in the conduct of research, all health professionals should be able to critically evaluate the disaggregation and analysis of data, the appropriateness of conclusions, and any gaps in knowledge. Number 3 involves the ability to incorporate sex and gender considerations into clinical decision-making. And number 4 involves patient advocacy by promoting respect for all persons, by ensuring that every individual's personal variables are incorporated into interpersonal interactions and the approach to care, not just for sex and gender, but for the intersectionality of all individual variables. In this way, we demonstrate a whole person approach to patient-centered care. It is understood that each health profession can align these tenets in different ways with their own competency statements and assessment benchmarks within the structures of their respective accrediting bodies. The ultimate goal is to raise a generation of healthcare practitioners who will approach clinical care through a sex and gender lens. In our conclusion statement, we assert the goal of enhancing patient safety, improving outcomes, reducing health disparities, and reducing the economic burden of care. But we're mindful of Dr. Jenkins' advice. This must traverse learning environments first. This work is about overcoming barriers to doing that. I very much appreciate the opportunity to present here today. Thank you for your time.